Hey guys, Dr. Caffery here. Today I'm going to continue our discussion on hidden causes of fatigue. Hidden cause number 4, inflammation. So what does inflammation look like? Well, inflammation can have varying degrees of severity. Hence, you can have varying degrees of severity with fatigue symptoms. So your classic inflammatory symptoms have been termed sickness behavior. These are things like fatigue, malaise, muscle aches, joint pain, brain fog, depression, lack of motivation. So these are typical things that you might have when you have a significant inflammatory state, a lot of times seen with infectious disease, like you have a cold or a flu or something like that, especially the flu. So inflammation is something that does not have to be that severe. You can have lesser expressions of that, and that's something I commonly see in practice. Someone may present and they may just have symptoms of fatigue and malaise. They may just not feel well, maybe have a little bit of brain fog, and we may run a blood panel and find that they do have this systemic state of inflammation. You clear that up and you see those symptoms resolve or improve. So on a blood chemistry, there are certain markers you want to look at when you suspect inflammation. And those markers are what are called acute phase reactants. There are certain markers that go up with inflammation, other markers that go down. You have to look at those critically, and you have to look at them in a very narrow window, especially when you suspect inflammation. There's the typical broad lab reference ranges, and then there's the more narrowed functional ranges that we look at, which are more conducive to optimal health and function. So, what are causes of inflammation? Well, let me just discuss some of the more common causes, because there can be a multitude of things. So a not uncommon scenario is I see individuals present with relapsing, remitting bouts of inflammation. So maybe they have just these periodic bouts where they just feel kind of tired, don't feel well, have some brain fog, maybe low mood or depression, and then that'll resolve and they feel a little better. Then they'll go a little bit for a little while, and then they'll have the same thing recur and come back. So relapsing remitting bouts of inflammation are very typical of autoimmune disorders. So that's something that I see all the time in practice. And the problem with autoimmune disorders is a lot of them don't get diagnosed until they're very end stage. So in the traditional medical model, they look for autoimmune disorders in the end stage, but they don't recognize them months, years, decades prior to you having this overt disease state. And it may just manifest then as relapsing, remitting bouts of inflammation and fatigue. So other causes of inflammation, low cortisol. So cortisol is a hormone. One of its jobs is to dampen inflammation, to keep inflammation low in the body. This is something that you can see levels of this deplete with chronic stress, for instance. Fatty acid imbalances, not taking in enough of our essential fats, our omega-3 fats. That's something that's real important for reducing your long-term inflammatory potential. Food sensitivities, that's a not uncommon thing. A food sensitivity is very different than a food allergy. A food allergy is this immediate immune hypersensitivity response, whereas a food sensitivity is more a delayed immune hypersensitivity response. It's a different type of an immune response. And that's something that is more common than people realize and can be a contributor to fatigue. So for instance, on some of the studies when they look at individuals that have non-celiac gluten sensitivity, the 3 most common symptom expressions were joint pain, fatigue, and brain fog, all symptoms of inflammation. Vitamin D deficiency. Vitamin D deficiency is the most common vitamin deficiency today, and it's something that's very common, and that can set up an inflammatory state in your body because vitamin D dampens inflammation. So that can be a contributor to fatigue. Infections. So chronic infections. You can have a viral infection that's latent in your body and become reactivated, or you could have some kind of subclinical infection, and that could be a source of ongoing inflammation resulting in fatigue. So in summary, if you have inflammation, that can be a definite cause of fatigue. Remember, there's different degrees of severity of this. It can be more severe, it can be more mild, it can be constant, or it can relapse and remit. So if you have fatigue, you need to work with a qualified practitioner so you can identify these patterns, and then more importantly, ask the question, why do I have this inflammation and this fatigue, and then get to the root source. I'm Dr. Caffery. Thank you so much for listening.